Hello, everybody. This is Yvette Laboy from YvetteLaboy.com and Inspired Wellness. Thank you for joining me here today for my Lupus and Heart Health webinar. For those of you who know me or don't know me, you know I'm a holistic health coach, but I'm going to let you know a little bit about myself. For those who do not know me, I'm a holistic health coach, lifestyle coach, Reiki Master, Magnified Healer. I also work with herbals. I'm a certified flower essence therapist. I also teach people about lupus and autoimmune conditions. I actually suffered with lupus for many years of my life. So I like working with people who are suffering from autoimmune diseases to help them transform their lives, specifically those with lupus, on the physical, mental, and emotional and spiritual level. I work with the body as a whole to create healing, well-being, and transformation. Now, prior to being a health coach and a nutrition specialist and health educator, I was a professional singer. And as you may or may not know, I suffered with systemic lupus for about 15 to 16 years of my life. Today's topic is going to be about lupus in the heart and heart health. And this is something, and no pun intended, that is very near and dear to my heart because I suffered from a heart condition due to lupus and it nearly took my life. And this is going back like 15, 16 years ago. The lupus attacked my heart. I had 2 stents implanted, one in my RCA artery and one in my main artery. And it really was a wake-up call for me. I say it was my rebirth because it made me really take a step back and realize that I had to take charge of my health and take a stand for my health. If not, I was going to die. So today I'm going to share with you some of my wisdom. I'm going to pour some of my wisdom into you and hope that you will learn something from this that you can use in your daily life. And maybe you can share this information with someone who has lupus as well to help them create a better and healthier life. So like I said, today's topic is going to be about lupus in the heart. One thing I want to share with everybody is that the body has its own innate ability to heal if you give it what it needs. Get in tune with your body and it will give you what you need. It will give you clues as to what it needs to nourish and heal it on every level. I want to pour some knowledge I have acquired that has helped me maintain a healthy body into you today. So get comfortable, stay a while, and hang out with me. Get a glass of water. Today's topic is lupus and heart health. And what I like to do before we get started, I like you to sit down and get relaxed. Unless you're driving, because if you're driving, I want you to keep an eye on the road. I don't want anybody dying. But I'd like you to relax. If you're not driving, get off social media, shut off the TV, because I'm going to share some really great information with you. But first, I'd like you to relax, feel your butt on the chair, and take 3 deep breaths. Okay? Breathe in and breathe out. Breathe in and breathe out. One more. Breathe in and breathe out. The reason I do this is because when you're relaxed, you tend to retain more information. Okay, so on to the webinar. If you suffer from lupus, you are at a 50% risk of developing coronary artery disease. Heart disease is the leading killer of men and women in the United States. While most people think of heart disease as synonymous with heart attacks, there are many more heart ailments and conditions which affect the heart. So if you're suffering from lupus, you are 50% at risk of developing coronary artery disease. Patients with systemic lupus erythematosus have a significantly increased risk of cardiovascular events due to atherosclerosis. And evidence strongly suggests that atherosclerosis plaque is largely driven by inflammation and an active immunological response. And premature atherosclerosis is a major occurring condition in systemic lupus. So coronary artery disease, I'm going to say CAD, or atherosclerosis, it's the hardening of the arteries, is the number one killer of both men and women in Western countries, whether they have lupus or not. It kills more people than cancer. Every 30 minutes, 20 people, okay, will die of cardiovascular disease. Okay, so the top contributors to heart disease, whether you have lupus or not, is number one is inflammation. And you know, if you have lupus or an autoimmune condition, inflammation, it's huge to be, you know, you got to control that inflammation or it's really gonna, you know, get to you. And it's the inflammation, number one, okay, on the list of top contributors to heart disease. Number two is smoking. And number three is infections, virus, bacterial parasites. Number four is high blood pressure. Number five is poor immunity, like in autoimmune diseases, like lupus, thyroid disease, MS. Number six is overeating, excessively heavy, unhealthy meals. Diabetes is number seven. 8, lack of exercise, and 9, emotional and physical stress. Now, women tend to have lupus more often than men, and when coronary artery disease develops in women, it tends to become symptomatic in the 3rd and 4th decades of life. And it will frequently manifest with chest discomfort, sometimes pressure, shortness of breath, sweating, profound nausea, vomiting, diarrhea, or weakness. It is said that that so-called typical symptoms of severe chest pressure with radiation down the left arm are less common in women, making women less likely to seek early medical attention. And the incidence of CAD in women with lupus is not known, but is higher than in women without lupus of similar age. Of course, men who have lupus also can develop CAD at an accelerated rate. Okay, so women and heart disease. When we think of heart attacks, we envision the numbness in the arm. This is a symptom that is most often seen in men and may not be present in women. Women with risk factors of heart disease may show signs that are different. For example, chest pain, shortness of breath, stomach pain, jaw pain, neck pain, back pain, nausea. When I had the problem with my heart, when I had my heart attack, I did not get the pain in the arm. I got back pain, and I was feeling pain in my jaw, but I had this severe back pain, and I was always very tired, and I was dizzy, and I had lightheadedness. So signs of heart attack or a heart condition don't develop overnight. The risk factors have probably been present for a long time before the heart attack even happened. Now, I'm going to talk a little bit about meridians. I don't have it here. My mentor spoke about this the other day. Well, when you feel like in the left arm, there's a connection there with the meridian in the left arm that's also connected to the heart in traditional Chinese medicine. So there is a connection with that. Okay, so what are the risk factors of atherosclerosis, you know, that is seen in patients with lupus? So the traditional cardiac risk defined by Birmingham studies such as high blood pressure and high cholesterol levels do appear to play a role. However, these factors alone do not adequately explain the increased incidence of cardiovascular disease seen in patients with systemic lupus, including increased risk for stroke, myocardial infarction, The increased risk of atherosclerosis in lupus patients is likely factual, resulting from a complex interplay between traditional cardiac risk factors and lupus-driven inflammation. Also, longer duration of steroid treatment and higher accumulation of steroid dose. Dose. I can't speak today. What's going on? Anyway, have been associated with higher incidence of atherosclerosis in patients with lupus, and may also impact traditional cardiac risk factors such as hypertension, obesity, diabetes, in addition to the prednisone uses. Now, I was on high doses of prednisone when I was first diagnosed with lupus, and it drove me crazy. And I'm sure you people out there who have lupus that have been on prednisone, you know what I'm talking about. So that's also one of the risk factors. Steroid medication, high blood pressure, inflammation, excessive clotting of the blood in the arteries and veins. Atherosclerotic heart disease is the third most common cause of death in lupus patients following kidney complications. And long-term use of steroids can lead to premature atherosclerosis. So folks, if you're taking a steroid, speak to your doctor and find out when they can start weaning you off of that steroid. You don't want to be on it for too long, okay? Also, an indirect complicating factor that may cause worsening of CAD symptoms is the adverse effect that lupus can have on the blood, okay? And this is called antiphospholipid syndrome. I'm going to call it APS, okay? Antiphospholipid syndrome, APS, is an autoimmune disorder that is characterized by excessive clotting of the blood in the arteries and veins. This is what happened to me, okay? This is exactly what happened to me, and it caused me to have coronary artery disease. Usually, blood clotting happens naturally as the body's response to cuts and scrapes and small breaks in blood vessels. But in APS, a tendency for excessive clotting can constrict or even block blood flow and end up damaging internal organs. So a tendency for the blood to clot more easily in some patients, thus leading to possible blockage of the coronary arteries. So if you experience chest pain or pressure, I strongly and I highly recommend, folks, you let your doctor know and have them run the proper tests to make sure you're not at risk. So as people with lupus live longer, they're at risk of developing APS and CAD. And I see it with a lot of people with lupus, and the lupus starts attacking their heart. So a common heart problem in people with lupus is inflammation. And that's inflammation in the sac around the heart. So this can cause shortness of breath, short chest pains. Lupus can also directly weaken the heart by causing it to get inflamed. Remember, lupus is a disease of inflammation. So these problems are usually treated with powerful inflammation fighters and medicines that calm down the immune system, such as steroids like prednisone. And remember, we said that long-term use of steroid can lead to premature atherosclerosis. So you want to watch that, folks, okay? You want to have a conversation with your doctor about the steroids and weaning you off of them if, you're feeling better. And there are other medications that you can definitely take. There's tons of them now. And these problems usually treated, like I said, with powerful inflammation-fighting medications that calm down the immune system, such as the steroids. But taking them for a long time can worsen the heart health. So, we got to watch this. And the most common of cardiac involvement in lupus patient is pericarditis. And I'm going to speak about this right now. The pericardium is a connective tissue that surrounds the heart and cushions it in the chest. When this becomes inflamed by lupus and other inflammatory diseases, it can cause chest pain, and it can be very painful. I had an issue with this as well when I was suffering from lupus. So if you're feeling that chest pain, Um, it could be that maybe you're not having a heart attack, but it could be pericarditis. I highly recommend you get yourself checked by a doctor to make sure what's going on in your body. You want to be in tune with your body. You want to know what's going on. So pericarditis is usually not life-threatening like myocarditis, but, okay, it can be quite painful. If you're recently diagnosed with lupus, you may confuse the pain of pericarditis with a heart attack, like I was saying before. However, it's similar. It's more similar like to pleurisy. What I mean by that is that it's worsened when you take a deep breath and may be made worse by changing the position that you're either sitting in, like leaning forward, or laying down. Also, if you're suffering from lupus, you can develop chest pains. You should seek medical attention, like I said, immediately so you can know for sure whether the pain is being caused by actual heart attack or pericarditis. This way, the doctor can give you the right treatment for your issue. Also, aspirin in high doses may be the first line of therapy, but other more powerful agents such as steroids may be necessary, but try not to be on them for too long. And non-steroidal anti-inflammatory agents like ibuprofen are commonly prescribed. And pericarditis usually resolves itself with treatment, but may return having you to take that therapy again. It's very rare that surgery is necessary to remove the inflamed pericardium. Usually, excessive fluid may accumulate around the heart between the pericardium and heart muscle and may lead to other problems. So, a natural way to reduce this is to avoid pro-inflammatory foods and eat an inflammatory diet. And I'm going to get more into that later on. Okay. I want to move on to valvular disorders. Just as the connective tissue of the pericardium may become inflamed, so too can the valves inside the heart can be affected. This is called valvular disorder, and up to 50% of lupus patients um, have some similar disorder, some valvular involvement. But it's usually mild and only evident in 20% of the patients. So inflammation of the valves can usually cause no symptoms initially, and most patients will have complete resolution of the valvular um, involvement. But after a period of time, scarring can occur. Excuse me. Scarring can occur after a period of time, and this can cause leaking or improper blood flow from inside the heart. So ultimately, this can lead to excessive fluid accumulation and heart failure. So if you feel like you have this disorder when you have lupus, I highly recommend, again, you get yourself checked by your medical practitioner um, to make sure that you're not suffering from this. Okay? Less than 20% of patients actually develop significant leak over a period of 5 years. When present, medical therapy is usually adequate to control symptoms and progression of the problem. So my point is, don't sit on it. If you feel something, go get checked. And that was one of the things I had about me when I was ill. If I felt something, I was really in tune with my body, and if I felt something, I got myself checked and I did something about it. Had I not been so in tune with my body and really jumped on things when I felt something was wrong with my body, I probably wouldn't be alive today. I probably wouldn't be here today to speak with you guys and share this information with you. So always be proactive, you know. So patients who very rarely is more aggressive treatment included, including surgical valve replacement necessary. But patients who have this type of heart damage are usually they're given antibiotics before most dental procedures, including cleaning and some general surgical procedures. I know some people who have lupus that have to do that, who've had a heart condition. Excuse me, taking some water. So, I didn't have to do that, thank God. I was okay. I didn't have that particular problem going on. So occasionally the heart muscle can become inflamed in lupus patients. This is called myocarditis. Okay, and chest pain, similar to what occurs with pericarditis or shortness of breath, may occur. They both of them have similarities. So once again, most patients will have minimal symptoms, but in more severe cases of myocarditis, the heart muscle becomes permanently damaged. The heart can enlarge and the muscle may become weakened and flabby, leading to congested heart failure. So medical treatment includes anti-inflammatory agents as well as specific therapy for heart failure when it occurs. Rarely does surgical treatment becomes necessary. Okay, so again, if you feel that you have this myocarditis, which is inflammation of the heart muscle, please, please, please go get yourself checked by your medical practitioner. We don't want to play games with our heart. There are specialized tissues inside the heart that initiate and conduct electrical impulses that signal the heart muscle to contract in an organized fashion. These tissues can become inflamed and permanent damage can occur later if the structures become scarred. So during an early inflammatory phase, the heart can become overly excitable and cause extra heartbeats, usually perceived as an irregular or irregularity of heart rhythm or palpitations. This is called heart arrhythmias. These arrhythmias do not usually need treatment, but if a problem, if it becomes a problem, if it's troublesome to the patient, medical treatment is very effective. Very rarely are they dangerous if the conduction system becomes damaged by scarring. So signals may be blocked and the heart can beat too slowly. And usually in very unusual circumstances, this slowing might be serious enough to require treatment of a pacemaker. So again, folks, if you feel you have this, you have lupus and you have this condition, and even if you don't have lupus and you feel something like this, definitely go see your medical practitioner. Another cardiac involvement that you can have if you have lupus is called endocarditis. And endocarditis is the endocardium is the tissue that lines the inner walls of your heart and the valves that separate the heart's different chambers. So lupus can cause inflammation of the endocardium. Lupus endocarditis is usually causes the surface of the heart valve to thicken or develop a wart-like growth, lesions. So these lesions can become infected, a condition called bacterial endocarditis. So a lesion also could break off and travel to the brain to form a blood clot. Both of these possibilities are potentially very dangerous. So again, if you suspect that you're suffering from endocarditis, go see your medical practitioner and, jump on it, folks, jump on it. You don't want to sit on these conditions. Another thing is what I spoke about, APS, and it is an autoimmune disorder that is characterized by the excessive clotting of blood in the arteries and veins. So I want to go over some herbs that are good for the heart. The first one is ginseng, and ginseng reduces cholesterol and has shown positive effects on blood vessel elasticity. The second one I want to talk about a little bit is Chinese angelica root, and it's traditionally used to treat blockage and help increase blood flow. Another one is sacred pine. It contains potent antioxidant in its barks and needles and nut that helps reduce inflammation in the blood and the blood vessels, lowering the risk of plaque buildup. And ginkgo. Okay, ginkgo also increases circulation and expands blood vessels. And a really great one is hawthorn berries. Hawthorn berries reduce fat and mucus accumulation, purify the blood, and improve blood flow. I think I have a recipe for hawthorn berries tea on my website, which is YvetteLaboy.com. And it's just really good. Hawthorn berries is great for heart health, and so is rosemary. Um, Linden, it assists in lowering blood pressure and helps to dilate blood vessels and eases inflammation. Of course, there's a lot more other herbs out there that are good for heart health. These are just a few that I wanted to share with you. Okay. Also, these herbs are available separately or in combined supplement from Chinese pharmacies and some health food stores. If you live in New York City, there's an herbal store called Power Herbs downtown, and or online you can check out Mountain Herbs. They got some really great herbs and combination of herbs. Um, so you definitely should talk to your medical doctor or cardiologist before you take any herbs if you're already taking prescription medications. And why? Because you don't want them to interact. Okay. So I'm going to talk about some heart healthy foods. Like I said before, rosemary. Oh my God, I love rosemary. I love the scent of rosemary. It's so great. It smells so good. Oh. So rosemary stimulates blood flow to the pelvic area and improves overall circulation. So rosemary is great for the heart. And not only does it smell amazing, but it's good for awakening your brain. It's good for brain health as well. You smell rosemary, it's like ah, so great, you know. So it improves overall circulation. I love cooking with rosemary. You can make rosemary tea as well. Another heart healthy food is walnuts. Walnuts satisfy your hunger and help your heart. If you ever look at a walnut, it looks like a little brain. It's great for brain health also, walnuts. High in omega-3 fatty acids. So it's really great for the heart, great for the brain. Salmon. I love salmon. By the way, I make an amazing salmon. Anyway, salmon is filled with omega-3 fatty acids, vitamin D and E, and it reduces risk of heart attack and strokes by decreasing clotting. So salmon is amazing, high in omega-3 fatty acids. And if you've been on my live chats before or my other webinars, I always speak about the omega-3 fatty acids and loading up on them because they really help combat inflammation. It's considered a anti-inflammatory food, so you want to include that in your diet. And wild blueberries. Um, They help to counter the buildup of plaque and improve cardiovascular health. They're high in antioxidants, rich in vitamin C, and it supports a healthy immune system. And garlic. Now, some people who have lupus can't tolerate garlic, and others can. But garlic is one of the most important herbs for heart health. Fresh garlic is by far the most effective method for reducing cholesterol. Not good for everyone. Like I said, it may irritate your gut. And I want to talk about cholesterol later on and the cholesterol myth. Okay. And you're gonna find folks, you're gonna find this interesting. But I'm gonna talk about that later. Asparagus is also a good heart healthy food. It's filled with nutrients such as beta carotene, folate, and fiber. And pomegranates, there's a chemical found in pomegranates um, that can help lower blood pressure, cholesterol, and the risk of heart blockages. I love pomegranate. I eat it all the time. Love, 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 love it. Love it in the fall. I love it now too. But as you know, folks, I like eating seasonally. So I eat my food, whatever's in season, that's what I eat. So I wanted to talk to you folks a little bit about cholesterol, what cholesterol does to your body. Know that cholesterol is not all bad. Millions have been warned about the dangers of high cholesterol and heart disease. Don't believe the hype, folks, okay? It's time for some shocking insight about this most often understood substance, okay? Cholesterol is an integral part of many hormones. Estrogen, testosterone are just two of them. These sex hormones are important during puberty and beyond for proper development and reproduction. So don't doom this naturally occurring substance too soon, okay? We're always being told, lower your cholesterol, cholesterol is not good. Don't believe the hype. Do some research. I found that the best way that I was able to combat my the disease that I had, lupus, was by educating myself and learning and researching and reading. So it's very important that you get to know what you're battling. When an army goes to battle, when a team goes out to play, what do? They study the other people, they study the enemy, they study the team. So you want to do that. You want to study your disease so you can be able to battle it better, so you can be able to fight it better, so you can be able to overcome it and know what to do, know what works and what doesn't work. One of the things that really helped me out. So anyway, cholesterol is responsible for brain synapses, communication between the nerve cells. Okay? Cholesterol also, okay, is vitamin D synthesized from cholesterol by the action of sunlight on the skin. So vitamin D is essential for bone health and protects against cancer. And cholesterol is needed for absorption of fat-soluble vitamins A, D, E, and K. And low-fat, low-cholesterol diets can be very unhealthy, especially for women, okay? And all major hormones are made from cholesterol: estrogen, progesterone, cortisol, DHEA, and testosterone, okay? Low-fat, low-cholesterol diets, like I said, can be very unhealthy for people, especially women. I'm going to say that again. And cholesterol repairs cells. All right, cholesterol is being transported to tissues as part of the inflammatory response that is there to repair the damage. So if we don't eat enough, our bodies divert cholesterol from our endocrine system to use for brain function, and also we need it for brain function and repair. So when that happens, it's almost impossible for the bodies to maintain hormonal balance. So know that cholesterol is imperative to our health. So demonizing cholesterol and taking statin drugs to unnaturally lower our levels sets the body up for failure. So some negative side effects of cholesterol lowering drugs include nerve damage, muscle degeneration, acidosis, anemia, cataracts, memory loss, dementia. Statins have been, there's a connection, they found a connection between dementia and statins and Alzheimer's. Sexual dysfunction, pancreas and liver dysfunction, increased risk for diabetes, and like I said before, dementia, low vitamin D levels, and cancer. They are alternatives to statins, but I would say speak with your medical practitioner or get in touch with a good naturopathic doctor or traditional Chinese medicine or holistic doctor that can give you maybe a healthier alternative. One of the things that I use to lower some of the cholesterol, instead of using statin drugs, it's called red yeast rice. It works just like a statin, but you don't get the really bad side effects that you get. All these side effects that I just mentioned. Okay, so I'm going to move on. So contrary to popular belief, high cholesterol is not the cause of heart disease. Know this, okay? Also know that the liver produces most of the cholesterol. If more is needed, it is processed from the foods we eat. Cholesterol is the protector of the body. The liver creates cholesterol to protect the body from inflammation. So it creates cholesterol in response to inflammation. So back in the 70s, nutritional science recommended reducing saturated fat and cholesterol-rich foods and encouraged us to eat margarine instead. What happened to heart disease when we took that advice? It skyrocketed. So today, we know better, right? We know butter is better than margarine. Margarine is a hydrogenated fat, We were also told that egg yolks were dangerous for the heart as far as eggs go. Many of the best nutrients reside in the infamous cholesterol-rich egg yolk. Um, Lutein, lecithin, vitamins A, D, E, and K. So more recent studies implicate stress, bacterial infection, and poor immunity as a more probable cause of heart disease. Of course, I'm not saying to have your bad cholesterol sky high. I'm not saying that. But I'm saying to look deeper, look deeper into what is causing certain conditions in your body. You know, let's try to look at the root cause and what's underneath everything. Okay, so most preventing heart disease. Okay, preventing heart disease is not about lowering cholesterol. A better way to support heart health is to reduce or eliminate food and lifestyle behaviors that contribute to stress, poor immunity, and overgrowth of bacteria. So common offenders include sugar and highly refined carbohydrates that can increase stress hormone, depress immunity, and feed bacteria. Excessive amount of caffeine that can increase stress hormone. Eating sick and diseased animals that have lived a stressed out and unhealthy life in factory farms. Pesticide-laden foods that damage the immune system, reproductive and endocrine system, okay? So you only need 20% of cholesterol from food. Be sure to check the labels of the foods that you buy and eat. Choose foods and ingredients that contain healthy cholesterol like unsaturated oils, olive oil, flax seeds, etc. And foods with healthy fats such as nuts, cold water fish, and avocado. I love avocado for, and all of you who know me know that I love avocado. So there are healthy fats and not so healthy ones that we can eat every day. The unhealthy ones come from processed baked goods, candy bars, fatty meat, um, and the like. Okay, eating these foods once in a while is okay, but eating them often and in large amounts affects your body, specifically your heart and blood vessels. And if you are suffering from an autoimmune condition, you are just setting yourself for a train wreck. So, in traditional Chinese medicine, there's a direct connection between the liver and the heart. The liver is responsible for the metabolism of our food and clearing the blood that goes to our heart. And in traditional Chinese medicine, the heart is not considered a pump like in modern medicine. Okay? It is responsible for human intelligence, compassion, joy, understanding, happiness, and intimate relationships. And I'm going to talk a little bit more about that when I talk about the heart chakra. Okay? Also, heart and small intestines are complementary organ systems. So, things that you can do to help yourself. You can change your eating habits. A nutritarian diet or plant-based diet. Choose more fruits and vegetables. For the folks out there in their 20s, fatty foods may not put weight on you in your 20s, but you're still doing a number on your arteries, okay? You can change your birth control method for the women out there. Birth control pills carry with it a risk of blood clots. If you smoke, you're at a greater risk, and clot can lead to heart attacks. So ask your GYN about safer methods. Reduce stress, okay? Stress causes lupus flare-ups. Constant unmanaged stress can lead to high blood pressure and weakened vessels. Also, don't eat oxidized oils and fat. Watch to not overheat. Do not overheat your healthy oils like olive oil, coconut oil, and flax oil. When these oils go beyond their smoke point, they become oxidized and can cause inflammation in the body. So, my people out there with lupus, again, watch out for these things. They can cause more inflammation in your body. You don't need that because lupus is a disease of inflammation. So we're trying to reduce the inflammation. Okay, especially we don't want to contribute to a heart condition. Also, get active. You knew this one was coming, right, folks? Because I always say this. Move the body. Move the body. Move the body. Anyway, get active. Burn calories each day. with about 30 minutes of moderate activity. This is just a start, okay? But get a jump on your health. It can keep you from becoming a statistic. Just walking. If you don't want to, you don't have to go to the gym, but walk, exercise, do something that you enjoy doing, whether it's yoga, if you want to work with weights, if you want to do Pilates, if you want to do Zumba, if you just want to walk or jog, whatever. Do something to keep the body moving. Okay? Now, next I want to talk about is the chakras. The fourth chakra. Okay, besides proper nutrition and daily physical exercise, the heart needs emotional healing. The heart chakra. This is the fourth chakra. When we speak of the chakras, there are 7 main chakras. The root chakra, the sacral spleen chakra, solar plexus, heart chakra, throat chakra, third eye chakra, and the crown chakra. We're speaking of the spiritual and emotional body. The fourth chakra, you knew I was going to talk about this, right, folks? Because you know I always talk about the spiritual and emotional body. The fourth chakra is the center of the 7 chakras, with 3 below and 3 above. If you look at the diagram I have here, let me move this here. If you look here, let me see, right here, my pointer. Can you see my pointer? Because I can't see it. But here, okay? This is the heart chakra right here. Its color is green. So, anyway. Okay. So, we're speaking of the spiritual and emotional body. Okay, this area is where the physical and spiritual meet. The fourth chakra, also referred to as the heart chakra, is located at the center of the chest, and it includes our heart. In traditional Chinese medicine, the heart is not considered a pump, and I spoke about this before. Okay, the heart is not considered a pump. The heart, cardiac, and plexus, thalamus gland, lungs, and breast. It also rules the lymphatic system. The Sanskrit word for the fourth chakra is anahata, which means unstuck or unhurt. Okay, interesting, right? What I wanted to say about this is the color associated with the fourth chakra is green, and the element is air. When your heart chakra is balanced and open, you are flowing with love and compassion. You are quick to forgive, and you accept love from others, and you love yourself. And out of balance, fourth chakra, heart chakra, is it's physical and emotional dysfunction that can occur. Heart disease, pneumonia, breast cancer, giving too much, taking care of others first, and exhausting ourselves. Allergies, respiratory problems, lung cancer. We tend to suffer from upper back pain, hanging on to bitterness and anger from past relationships, inability to forgive, jealousy, and overexcitability. Okay? So the balanced fourth chakra gives us the ability to have belief in the divine plan, the ability to reach out and hug someone. That's a strong, loving fourth chakra. Now I spoke about the negative effects of a unbalanced chakra. So, for example, arm crossing, when you cross your arms in front of you, right? That can signify not for everybody, okay? I don't want people saying, "Oh, I do that," and blah 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 blah. You blah, okay? No. For example, arm crossing in the emotional imbalance, okay, is an emotional imbalance and could be a physical protecting the heart, lungs, and breast. Could also mean a heart condition. And so when you see somebody like that, when I see somebody standing like that all the time, I kind of wonder, why are they protecting their heart? Were they hurt? Do they have some sort of physical problem with their heart, lungs, or breast? or was there some sort of emotional thing they went through that dealt with the heart? So to heal an imbalanced fourth chakra, you need to do a lot of forgiveness work, letting go of the past, releasing anger, learning to love ourselves. You need love and hugs. The fourth chakra foods are green colored foods like leafy green vegetables, spinach, green tea. Detrimental to heart energy is the inability to forgive others as well as an inability to forgive oneself. Okay? So that's the fourth chakra. Now I wanted to go over, since, we're talking about traditional Chinese medicine and we're talking about the chakras and all these um, spiritual and emotional things. I wanted to talk a little bit about bitters and traditional Chinese herbs for heart health. Okay. You have kale, parsley, which is good for high blood pressure. According to traditional Chinese medicine, the bitter flavor is connected with supporting healthy heart function. Bitter flavored foods and herbs can help cool the body and drain excessive heat. If someone is suffering from heart disease, they may be better off eating something bitter rather than something sweet, because sweet causes inflammation in the body. Bitter flavors strengthen the heart. You also have endive, arugula, dandelion, ginseng, gongqiu, sacred pine, ginkgo, and hawthorn berries. These are all bitters and traditional Chinese herbs. The bitters are on the left, and you have traditional Chinese herbs on the right. Oh, I'm having a hard time reading this. Okay. I also wanted to talk a little bit about herbs for liver health. And I'm supposed to have that here, but for some reason I'm not coming across it. Herbs for liver health. You have Oregon grapefruit. It helps the liver by improving the steady flow of bile and blood through the liver. It also assists in cleansing the blood. Milk thistle seeds. Milk thistle has been clinically proven in cleaning and cleansing the liver and supporting the liver. The best part of it is that you can take it as long as you like. Dandelion root has many positive effects on the liver. It acts as a liver cleanser, stimulates the flow of bile through the liver. It's also a good source of iron, potassium, and zinc. Turmeric, it assists the liver by helping the body flush out unwanted toxins by stimulating the enzymes responsible for the task. Peppermint, it stimulates the flow of bile and is effective in maintaining cholesterol levels, which helps the liver carry out its function for filtering out toxins from the blood. Cardamom aids the liver, which detoxification process helps support the health of both the liver and gallbladder. Okay, so I just want to go over these for you folks. And, stress, lupus, and heart disease. Now, stress is a part of life, okay? We can't avoid it. But know that when you have lupus or an autoimmune condition, stress can really, it can really, left unmanaged, it can really affect you, can cause flare-ups, and it can put really, physical stress and emotional stress can put a lot of strain on the heart. Stress can kill you, folks. When your body reacts to stress, our body goes into a fight or flight mode all the time. Constant unmanaged stress can lead to high blood pressure. The vessels of the blood can become weakened due to that pressure, which leaves them wide open to plaque formation and aneurysms later on. When we don't know how to manage stress, it can lead to many poor choices and bad behaviors. For one, we eat less healthy food. If you're stressed on your job and get pressed for time, you are more likely to hit the vending machine for that fast food or the fast food joint down the street because we're looking for comfort, that comfort food, something sweet. Okay? So don't do that. Look for alternative ways to deal with your stress, whether it be meditation, creative visualization, talking to someone, going to the gym, doing something special for yourself. Okay? There are other ways to dealing with it. Okay? Um, Smoking. If you suffer from lupus, you should not smoke. Smoking is another habit that increases heart disease. Smoking decreases lung capacity. The nicotine can cause blood vessels to become less elastic. Okay. Um, drinking, drinking. That's another thing. If you suffer from lupus, drinking is yet another habit that may be picked up during times of stress. But know that alcohol affects your liver. The liver filters the blood, processes cholesterol and triglycerides. With the liver working improperly, you can develop metabolic imbalances in the body, leading to diabetes and other diseases. So managing stress, like I was talking about before, is very important to overall health. The effects that stress has on your life goes beyond sleepless nights. Know this. And the only person who can, okay, reduce your risk and help you get or stay healthy is you. Make good food choices. Diet is so very important, folks, when it comes to our health. Um, Reducing the risk of heart disease caused by lupus can be easy and delicious by choosing wholesome foods that are naturally and ethically raised without chemicals or preservatives. Get up, move around, live an active life, be happy. Okay? And also get support. Find people and professionals who can support you on your healing journey. Okay? Now, this is all I have to share with you folks tonight. Of course, there's so much more I can tell you about lupus and heart health, but we'd be here all day. You know, we have things to do. So if you want more information about my lupus programs and my other health programs, go to my website, which is YvetteLaboy.com. And on my website, you can sign up for my newsletter. And when you sign up for my newsletter, you'll get my gluten-free cookbook. It's an ebook, a gluten-free ebook. You'll get that. You can download that for free when you sign up for my newsletter on my website, which is YvetteLaboy.com. You can follow me on Facebook. I am Yvette Laboy Coach. On Twitter, I am Holistic Gal. On YouTube, I have a YouTube channel with tons of videos about lupus and health and nutrition and what you can do if you have an autoimmune condition like lupus to create a better life, a healthier life, to help you manage symptoms better. Okay, so you can go there. That's Yvette Laboy. On Instagram, I am One Holistic Diva. I am Yvette Laboy from YvetteLaboy.com. Thank you all for joining me tonight on my webinar, Lupus and Heart Health. I hope that you learned something tonight and that you can take this information to help create a healthier and happier life, to help create a healthier heart. Thank you for being here with me tonight. I look forward to seeing you on further webinars. I only have a few minutes left, but if anybody has questions, if anybody has any questions, you can put them down here in the chat area if you have any questions. And if not, okay, there, I think I have muted everybody. And if not, then thank you for joining me tonight, folks. I look forward to seeing you on future webinars and live chats. I do live chats on my Facebook page, so you can find me on there. I also started doing live chats on my Instagram page. Anyway, thank you for joining in tonight. Have a great evening and a great week. Bye. God bless.